Good afternoon, everyone. This is Doc Dave on Call with Doc Dave. And I'm going to do episode number 28 today, which is called cholesterol. Oh, that dreaded cholesterol. Yes, we all are concerned about that. We all try to follow our levels. We try to follow our diets. We try to exercise. But what causes cholesterol to be elevated? What types of cholesterols are there? What are the different ratios you need to know? How do you treat it? And what are the complications? So this is what we're going to discuss today. So this is going to be very educational, and everybody can use this episode because eventually, everybody's cholesterol creeps up as you get older. So this is information that I think will be very valuable for you, your family, and friends. So let's get started. All right, so what are the ratios? These are the important things you need to know about cholesterol levels, because cholesterol levels, if you just get your plain cholesterol level, it could be 150, it could be 200, it could be 250, but it's the ratios that are important. It's not the actual single level. And this is a little complicated, but not terribly so. I'll try to give it to you in terms you can understand, and don't hesitate to go back and listen again if you need to, and maybe take little notes on these ratios. So the main ratio is your triglycerides to your HDLs. Now, your HDLs are your good cholesterols, or the high-level cholesterols. And this ratio should be less than 2 to be ideal. It could be 2 to 4, but ideally you try to keep it under 2. So for example, if you've got a cholesterol level of 200, which a lot of people consider to be high, then you want to have a HDL of at least 80 to 100. That would be ideal. So high rates or high levels, high ratios give you an increased risk of coronary artery disease, strokes, and diabetes type 2, which is your adult onset diabetes. So if you got a ratio level of 7 or 8, you're in a high risk factor for having these complications. Now, lower HDL with high triglycerides is very dangerous. So I want to emphasize that again. Okay, so what type of cholesterols are there? Now we're going to go into the types of cholesterols. You got HDLs, which are your good cholesterols. You want this to be a high level, preferably in the 70 to 100 range. Greater than 40 in men is considered the lowest you should be, and greater than 50 in females is the lowest you should be. So men, if you're 70 or 80, you're generally in pretty good shape. Females, if you're 70, 80, or 90, you're in good shape. So what are LDLs? Now, LDLs are your low cholesterol, and it's the bad cholesterol. This is the one you want to keep the levels as low as you possibly can. You want to have this level less than 100. Okay? So that's the level, the number you gotta know. So total cholesterols to the HDL ratio is considered good if it's less than 5 to 1. So earlier we were talking about triglycerides. Now we're talking about cholesterol. Now the triglycerides, again, you want the levels between 2 to 4. The cholesterols, if you have the level of 5 to 1, is a good ratio. Ideally, 3.5 to 1 is the best ratio. So an example, total cholesterol, 200, HDL, 50, perfect. There you've got a 4 to 1 ratio. Cholesterol, 170, HDL, 50 is ideal. That's where you generally should have your ratios being that in that area. So it's pretty easy. When you're calculating, you either do the triglycerides over the HDL ratio or the cholesterol over the HDL ratio. Again, the triglycerides should be between 2 to 4, and the cholesterol should be 5. Now, complications, which I mentioned a little bit earlier, if these ratios are not ideal or good, and they get into the bad range, in other words, your triglyceride to HDL ratio goes above 5, or your cholesterol to HDL is greater than 6, then you got a little bit of an issue. And the problems you get with that are coronary artery disease, which lead to heart attacks, okay? You've got strokes, which will lead to, impairment of your ability to speak, move, cognizant thinking. Don't want that. You've got peripheral vascular disease associated with these ratios being high, and that's like clotting of your major arteries in generally your lower extremities, usually in the pelvis area where you have big major arteries, and into the femoral area where you have a large major artery. And then as you get smaller and narrower, as you go further down into your leg, into your calf area, the arteries are smaller, narrower, and therefore easier to clot off with cholesterol emboluses. So this is called claudication. You walk and you get pain in your leg. That's what claudication is. You go out for a nice walk and you start getting pain in your calf areas. That means that the arteries are starting to cramp up and you're getting decreased vascular flow down river, for lack of better words, of that artery. So, the types of fats in your diet generally control what your cholesterol and triglyceride levels are going to be. Now, there are good cholesterols, believe it or not. And the good cholesterols are what we call polyunsaturated fats. These lower your LDLs, which are your bad cholesterol, and increase your HDLs, which are your good cholesterols. And I'm going to go over in a few minutes here what are polyunsaturated fats. And the bad cholesterols, which are your saturated or your trans fats. These increase your LDL, which is your bad cholesterol, and decrease your HDL, which is your good cholesterol. So, hopefully we got through that without too much complications. I kind of warned you it was going to be a little bit difficult, but you need to know these ratios and you need to know what makes up the ratios. You need to know what a good ratio is, a bad ratio, and what types of fats give you good ratios and what types of fats give you bad ratios. So, how do you lower your cholesterol? Well, the main thing is dietary. And things to avoid, foods to avoid that cause your cholesterol levels to go up and your LDLs to go up and your HDLs to go down. And these are your trans fats. Now, first thing is fatty meats, beef, pork, and lamb. You can have it, but you got to have it in moderation and in extreme moderation. You can't be eating beef, pork, or fats every day. So, dairy products, whole milks, cheese, butter, ice cream, heavy creams. Those are things you need to avoid in your dairy. So go to low-fat milks, less than 2%. Watch what types of cheese you eat. Some have higher fats than others. Butters, you can go to, different types of butters that are, artificial margarines and stuff like that will have lower bad fat levels in them. Now, processed meats, okay. Hot dogs, sausages, pizzas, burgers, all these things we like. So I'm not saying you can never have these again, but if you got cholesterol problems, you really got to monitor your usage of these. If you don't have cholesterol problems, you're one of those fortunate souls, then it's okay to eat these types of foods more often. But most people don't have that. Most people have to really watch their diet to keep their cholesterol and bad cholesterol levels low. Now, shortenings and certain types of margarines. The other thing I should have mentioned in processed meats, on top of what I already mentioned, is bacon and deli meats. Got to be careful with those. Baked goods, cookies and cakes. Got to watch that. Egg yolks. A lot of people just eat egg whites. And the reason they do that is because they try to avoid the yolks as much as possible. Now, you can have yolks, but, if you're eating eggs every day, you should probably, say you have 3 eggs a day, take out the yolk in one of the eggs or maybe even 2 of the eggs. And you still get, the taste of the yolk, but it's somewhat diluted down. Organ meats are bad. Livers and kidney. I don't know who eats that anymore, but if you do, be careful with it. Shellfish, shrimps, and lobsters are high in trans fats. So those are things that you kind of should avoid. They're common sense things. I think we all know this. We just got to, be diligent in managing how often and how much of this type of food that we do eat. So here we go now. Good foods. This will treat your high cholesterol and your trans fat levels. Beans. Kidney beans, chickpeas, black beans, lentils, those are all good for your cholesterol levels. Lean cut meats. So see, you still can eat meats, but you got to, eat the right kinds. Skinless chicken. You can't have the skin on there and frying it in oil. I know that tastes better. The chicken without the skin is a little bland, but it's much healthier for you. Lean ground beef. So you can make your burgers, but make them out of lean ground beef. It should be at least 90% lean beef for your hamburgers. Sirloin. That's a good steak you can eat. Very low in fats and trans fats. And pork loin is also good. Now, fishes. Omega-3. Good fishes to eat. There are bad fishes to eat, but these are the good fishes. Rich in omega-3s, salmon, trout, mackerel, and herring. Number 4, whole grains. The most important ones are oats and fibers. Those are good for cholesterol. You'll see on the Cheerios box, it's got the big red heart on it because Cheerios are made from oats, as well as Quaker oats, even though people say, well, it's eating horse food. But no, it's Quaker oats are okay for you as well. Now, healthy fats. Okay, so let's talk about healthy fats versus unhealthy fats again. We talked about them a little bit earlier, but I want to go in a little more detail. Healthy fats are your polyunsaturated fats and your monosaturated fats. So these are generally found in the following foods: olive oil, avocados, sunflowers, nuts, veggies, fruits, and leafy greens. Those are healthy fats that you can eat. So now you got diet. The next thing is exercise. You exercise, your good and bad cholesterols will margin the ratios so that they're in the healthy range. So exercise, they say you should be getting 20 minutes of exercise every day. It's really only walking a mile at 3 miles an hour. So people need to exercise better, watch their diet if they're having cholesterol problems. You don't have to go to the gym and sweat and all that stuff or play pickup basketball games every day, but just go out for a nice walk, a little jog, ride a bike on the weekends. These all add up and they all help lower the bad cholesterols. Now, the last thing I just want to briefly go over, because I'm not going to go into the doctor thing with this, but it's medications. And the most common medications that are used for high cholesterol are statins. Everybody's probably heard that word and knows statins. And how do they work? Well, they decrease cholesterol production in the liver by blocking the enzyme that produces cholesterol. So that's important. And they remove cholesterol from the body. So they prevent it from getting absorbed and they excrete it out. That's how statins basically work. Now, they increase the HDL and decrease the LDL so that your ratios are going to be under 5. So that's the main thing that you want to watch for. Now, the side effects of statins: muscular cramps and pain, and even more important, liver damage. So if you're on statins, obviously your physician has prescribed these for you. You need to follow up every, 3-4 months, maybe get a liver function study test done to make sure that your liver enzymes are not elevating from the use of the statins. And if you're having bad muscle issues, cramps, pains, you should bring that to your physician's attention as well. So there you go. That's pretty much everything you need to know about cholesterol. We went over the ratios. We went over the types of cholesterols. We went over the complications, the good and bad cholesterols, the diet, the exercise, and the medication. So if you listen to this and you like this, send it to your friends and family. Get everybody involved with this, because you don't want heart attacks, you don't want strokes, you don't want type 2 adult onset diabetes, you don't want peripheral vascular disease, and all of these things will be minimized and by keeping your ratios in the area they should be in. Get your cholesterols checked, maybe once a year. It's called a lipid panel. It'll do the cholesterols, the HDLs, the LDLs, the triglycerides. It'll give you your ratios. Everything's printed out. You know exactly where you stand. So I hope you enjoyed this. I did. And if you like it, hit the like button. Don't hesitate to subscribe. I love subscribers. And remember now, like I tell you every time, I'm your friend, not your doctor. So if you got these issues, make sure you discuss them with your doctor and get on the appropriate diet, exercise, and medication. Okay, we'll be back again. I'll be back again. Hopefully you'll be back again too. So I guess I can say we for another interesting, educational, and new episode coming up, number 29, shortly. So thank you for your time, and I hope you enjoyed this.